what is varicocele and will it affect the fertility or the sperm count? Now let us see what is varicocele. So varicocele is actually the dilatation of the veins which are scrotal veins or the veins which are present around the testes. Let us see why the testes are placed outside of the body. Testes are normally placed outside of the body in the scrotal sac because the sperms require temperature which is lower than the normal body temperature. Normal body temperature is usually 37 degrees and the scrotal temperature is usually 1 or 2 degrees less than that. So this less temperature helps in having healthy sperms and good motility sperms. So what happens in varicocele is, this is the model of the male reproductive system. This is the testes. What you are seeing in the red, these are the plexus of veins which is present around the testes in the scrotal sac. So what happens in varicocele is, these veins get dilated or they become bigger in diameter. Because they are dilated or they are getting bigger in diameter, the blood flow to the testes increases. Because the blood is flowing from the body, the temperature of the blood is 37 degrees, which is higher for your testes, where the sperm production is taking place. So this increased blood flow and increase in the temperature is not good for your sperm quality. This is the reason why the varicocele can affect the sperm count and sperm motility as well. So how do you know that you have a varicocele? Most of the times varicoceles can be asymptomatic, or there may be problems related to the semen parameters or sperm parameters in semen analysis, like less count, less than 15 million. Motility might be on the lesser side, like grade 3 or progressive motility less than 30%. The symptoms which can be present is, sometimes you can see a visible dilatation of the veins, especially when the grade of varicocele is higher, like grade 3 or grade 4 varicocele. Usually grade 1 and grade 2 varicocele may not cause any symptoms. Sometimes there might also be a dull aching pain in the scrotum. Also, sometimes if the varicocele is secondary to some issue like some tumor in the abdomen or some mass or lump in the abdomen, the symptoms may be associated with that. But most of the times varicocele happens because of the increased pressure inside the veins or increased pressure inside the abdominal cavity. So why this increased pressure may happen is, it can be related to the weight lifting or prolonged standing, or it can be, as I already mentioned, because of some tumors, or it can be just because of chronic cough or constipation or straining, which increases the diameter of the veins and increases the blood flow to the testes. So usually grade 3 and grade 4 varicocele, if somebody wants to try naturally or wants to conceive with IUI, can require treatment like varicocelectomy. Also, if it is prolonged or long-standing varicocele, which is grade 3 or grade 4 varicocele, it not just affects your sperm count and motility, it may also cause testicular atrophy, which means the testes can shrink in size and it can permanently damage the sperm production in the testes. So if you have any issues related to your sperm parameters in semen analysis, please consult a fertility specialist, and if required, get yourself evaluated for varicocele. Varicocele is diagnosed on scrotal ultrasound, which is a ultrasound of the testes and the blood vessels around it. And based on the grade of varicocele, your semen parameters and overall picture, like your wife's age, her egg reserve, any other fertility issue, doctors can advise you about further treatment. Not all varicoceles require surgery, but higher grade varicoceles, if kept untreated, can damage your testes permanently. I hope this was helpful.